Syphilis, a word whispered with fear and fascination for centuries, carries a legacy as old as humanity itself. This infection, a master of disguise, has plagued humankind since time immemorial. Its shadow stretches back to antiquity, leaving its mark on history, art, and literature. Once known as the Great Pox, syphilis instilled terror. Its victims often suffered agonizing symptoms and disfiguring complications. The disease spared no one, striking emperors and paupers alike. Its influence resonated through royal courts and battlefields. Syphilis even left its mark on the evolution of medicine. The fear it instilled spurred desperate searches for cures, contributing to our understanding of infectious diseases. Even today, syphilis remains a global health concern. The World Health Organization estimates millions of new cases occur annually. This enduring presence underscores the importance of understanding this complex disease. We must learn its secrets to effectively combat its impact. Syphilis is a story of a cunning adversary and the relentless pursuit to unravel its mysteries. It is a tale of scientific discovery and the enduring power of knowledge in the face of a formidable foe. At the heart of syphilis's reign of stealth lies its causative agent, the bacterium Treponema pallidum. This microscopic spirochete, a spiral-shaped organism, possesses an arsenal of adaptations that allow it to thrive within the human body. Its corkscrew-like shape grants it remarkable motility, enabling it to penetrate mucous membranes and burrow deep into tissues. Treponema pallidum is a fragile organism outside the human body. It cannot survive long on surfaces. Transmission primarily occurs through direct contact with an infected lesion. These lesions, called chancres, often appear in the genital area, but can also form in the mouth or on the skin. Once inside the body, Treponema pallidum begins its insidious invasion. It multiplies rapidly, spreading through the bloodstream and lymphatic system. The bacteria target various organs, including the skin, heart, brain, and nervous system. Their presence triggers an inflammatory response as the body attempts to fight off the infection. The immune response, while crucial in recognizing and attacking the bacteria, can also contribute to the damage caused by syphilis. The inflammation triggered by the immune system can lead to the formation of granulomas. These are small areas of inflammation that disrupt the normal function of tissues and organs. Syphilis is a master of disguise, its progression marked by distinct stages that can mimic other diseases, earning it the nickname, the Great Imitator. Understanding these stages is crucial for effective diagnosis and treatment. The first stage, primary syphilis, typically begins with the appearance of a chancre. This painless sore, often appearing at the site of infection, can easily go unnoticed. Despite its inconspicuous nature, the chancre is teeming with Treponema pallidum, making it highly infectious. Without treatment, the chancre heals within weeks, leading to a deceptive period of latency. The second stage, secondary syphilis, emerges weeks or months later. This stage is characterized by a widespread rash, often affecting the palms of the hands and soles of the feet. Other symptoms include fever, fatigue, swollen lymph nodes, and hair loss. Like the chancre, these symptoms can resolve without treatment, leading to a prolonged latent phase. Latent syphilis, despite its silence, marks a critical stage. The bacteria, although not actively causing symptoms, continue to multiply and spread throughout the body. This stage can last for years, even decades, with the potential for serious complications. The final stage, tertiary syphilis, represents the most severe manifestation of the disease. Years of untreated infection can lead to damage to the heart, brain, blood vessels, and nervous system. This stage can manifest with a range of debilitating symptoms, including blindness, paralysis, dementia, and even death. Diagnosing syphilis is a meticulous process, requiring a combination of clinical acumen and laboratory investigations. It's a journey that often begins with the patient's history, piecing together a puzzle of past exposures and symptoms. The first clue often lies in the presentation of a chancre or rash, prompting the physician to suspect syphilis. However, these signs can be subtle or absent, especially in the early stages. Therefore, a thorough sexual history is essential, uncovering potential routes of transmission. Laboratory tests are the cornerstone of syphilis diagnosis. These tests aim to detect either the presence of Treponema pallidum itself or the body's immune response to the infection. The choice of test depends on the suspected stage of the disease and the available resources. Direct detection of Treponema pallidum involves obtaining a sample from a chancre, or lesion. This sample is examined under a microscope, searching for the characteristic spiral-shaped bacteria. Dark field microscopy, a technique that illuminates the sample against a dark background, enhances the visualization of these elusive organisms. Section 5. Beyond the Wassermann modern syphilis detection. While direct detection methods provide definitive proof of infection, they are not always feasible. In later stages of syphilis, when chancres are absent, indirect methods that detect the body's immune response become crucial. One such method is the detection of antibodies, specialized proteins produced by the immune system to fight off specific infections. When Treponema pallidum invades the body, the immune system mounts a defense generating antibodies against the bacteria. Serologic tests, which analyze blood samples for the presence of these syphilis-specific antibodies, are invaluable tools in diagnosing the infection. These tests can detect both treponemal antibodies, which target Treponema pallidum directly, and non-treponemal antibodies, which target substances released during the infection. The Venereal Disease Research Laboratory test and the Rapid Plasma Reagin test are examples of non-treponemal tests. These tests are widely used for screening due to their cost-effectiveness and rapid turnaround time. Treponemal tests, such as the fluorescent treponemal antibody absorption test and the Treponema pallidum particle agglutination test, are more specific for syphilis. These tests are often used to confirm a positive non-treponemal test and to differentiate syphilis from other conditions that can cause false positive results. The ability to accurately diagnose syphilis relies heavily on a combination of clinical suspicion, thorough patient history, and appropriate laboratory testing. Early detection is key to preventing the long-term consequences of this stealthy infection. Section 6. Penicillin's Triumph. A historical turning point. The discovery of penicillin in 1928 marked a turning point in the fight against syphilis. This revolutionary antibiotic, with its ability to kill Treponema pallidum, transformed syphilis from a dreaded and often deadly disease to a treatable infection. Prior to penicillin, treatment options for syphilis were limited and often ineffective. Mercury and arsenic compounds, while somewhat effective, carried significant risks of toxicity. The advent of penicillin revolutionized syphilis treatment, offering a safe and effective way to eradicate the infection. Penicillin's efficacy against syphilis lies in its ability to interfere with the bacteria's cell wall synthesis. Treponema pallidum, like all bacteria, relies on its cell wall for protection and survival. Penicillin disrupts this process, weakening the cell wall and leading to bacterial death. The introduction of penicillin in the 1940s led to a dramatic decline in syphilis cases. Its success in treating the infection fueled optimism that syphilis could be eradicated. However, challenges remain in ensuring access to treatment and addressing the social and behavioral factors that contribute to its spread. Beyond penicillin current treatment strategies. While penicillin remains the cornerstone of syphilis treatment, other antibiotics are also effective against Treponema pallidum. These alternatives are crucial for individuals allergic to penicillin and for addressing potential cases of antibiotic resistance. Ceftriaxone, a cephalosporin antibiotic, has demonstrated efficacy in treating syphilis, particularly in cases involving neurosyphilis, where the infection has spread to the brain and nervous system. Doxycycline, a tetracycline antibiotic, is another option for penicillin-allergic individuals. The choice of antibiotic, dosage, and duration of treatment depend on the stage of infection, the patient's overall health, and the presence of any complications. Early treatment is crucial to prevent the long-term consequences of syphilis, including damage to the heart, brain, and other organs. Despite the availability of effective treatments, challenges remain in syphilis management. One significant concern is the rise of antibiotic resistance. The indiscriminate use of antibiotics can lead to the emergence of drug-resistant strains of Treponema pallidum, making treatment more challenging. Another challenge is ensuring access to care, particularly for marginalized populations who may face barriers to healthcare services. Stigma surrounding sexually transmitted infections can also prevent individuals from seeking testing and treatment. Syphilis in the 21st century, challenges and the future. Syphilis, once thought to be on the verge of eradication, has re-emerged as a public health concern in the 21st century. Factors such as changing sexual behaviors, increased travel and drug use have contributed to its resurgence. One significant challenge is the rise of congenital syphilis, a devastating form of the disease that occurs when a pregnant woman transmits the infection to her unborn child. Congenital syphilis can lead to miscarriage, stillbirth, or serious health problems for the infant. Addressing the syphilis epidemic requires a multifaceted approach that combines effective treatment, prevention strategies, and public health interventions. Increasing awareness about syphilis, promoting safe sex practices, and expanding access to testing and treatment are crucial steps in curbing its spread. Research efforts continue to develop new and improved diagnostic tests for syphilis, as well as to investigate potential vaccines that could offer long-term protection against the infection. Understanding the complex interplay between Treponema pallidum and the human immune system is essential for developing effective vaccines. The importance of awareness and prevention. Preventing syphilis requires a multi-pronged approach that combines individual responsibility with public health initiatives. Raising awareness about the disease, its modes of transmission, and the importance of early detection is paramount. Education plays a vital role in empowering individuals to make informed decisions about their sexual health. Comprehensive sex education programs should provide accurate information about sexually transmitted infections, including syphilis, and emphasize the importance of safe sex practices. Condom use remains one of the most effective ways to prevent the spread of syphilis and other sexually transmitted infections. Condoms act as a physical barrier, preventing the exchange of bodily fluids that can transmit the bacteria. Regular testing is essential for individuals who are sexually active, especially those with multiple partners, or who engage in high-risk behaviors. Early detection through testing allows for prompt treatment, preventing the long-term consequences of syphilis and reducing the risk of transmission. Public health initiatives, such as contact tracing, play a crucial role in controlling syphilis outbreaks. Contact tracing involves identifying and notifying individuals who may have been exposed to the infection, allowing them to seek testing and treatment if necessary. A final word: syphilis and the lessons of history. Syphilis throughout history has served as a stark reminder of the interconnectedness of human health and behavior. Its resurgence in recent decades underscores the importance of continued vigilance, even in the face of effective treatments. The lessons learned from the history of syphilis, from its devastating impact to the scientific breakthroughs that led to its control, highlight the importance of scientific inquiry, public health measures, and individual responsibility in safeguarding human health. As we move forward, it is imperative to prioritize research efforts aimed at developing new diagnostic tools, treatments, and ultimately, a vaccine for syphilis. By understanding the intricacies of this complex disease and working collaboratively to address its challenges, we can strive to relegate syphilis to the annals of medical history. Syphilis, despite its long and storied past, need not define our future. Through education, prevention, and a commitment to comprehensive healthcare, we can break the chains of transmission and protect future generations from this enduring threat.